You know, some of you tuning in today may be on the front lines of trying to protect jail populations and correctional staff from the COVID outbreak. And what I want to try to do today is to give you the perspective of somebody who's not on the front lines, but who's been thinking about what, if anything, we might be able to learn from this episode about incarceration in the United States. And just before I leave the title slide here, some of the graphs and data I'm going to be pointing you to are available on the Public Safety Lab's website. So I'm giving you the address here. We also sometimes release these through our Twitter accounts, either the lab's Twitter account or my account. And so if you're looking for something and you don't find it on the lab website, it might be available through the Twitter accounts. So just a brief overview here. I want to talk, just to give you a little bit of a wind up, I want to talk a little bit about inmate level jail data and the extent to which it does not exist. I want to talk about our project, the Jail Data Initiative, which is an attempt to try to source that data. Talk a little bit about what we know about the impact of the virus outbreak on local jail populations. And then what I hope is maybe the most useful part of the conversation today is to tee up some ideas about what we might be able to learn from this episode and hopefully to get your feedback in the Q&A. All right, so inmate level jail data. So just to give a little bit of background about incarceration for those of you who are not incarceration experts, of which I would include myself, this is a graph from our friends at the Prison Policy Initiative, just telling us about incarceration in the United States. We incarcerate about 2.3 million people per year, highest rate of incarceration in the world. And a little bit over half of the incarcerated population are in state prisons. About a third are sitting in county jails, and then the remainder in federal detention facilities. So researchers like me, one of the things we're really interested in is trying to understand the impact of this widespread practice of incarceration on outcomes. So if any of you are familiar with working with criminal justice data in the United States, we have terrible criminal justice data in the United States. However, some state prison systems have better data than others. And as a consequence, we do have a handful of recent papers on the impacts of incarceration in state prison systems. So there's a paper by Mike Mueller-Smith at University of Michigan using Harris County data in Texas that suggests that defendants who are as if randomly assigned to a judge who was more likely to give them an incarceration sentence have worse post-incarceration outcomes, both in terms of their criminal records and in terms of their labor market outcomes relative to defendants who were not assigned to incarceration. So we're starting to learn a little bit about incarceration at the state level. We don't know much about incarceration or detention at the local jail level, and that's troubling for two reasons. The first is that the approximately 750,000 individuals, this is again from Prison Policy Initiative, the approximately 750,000 individuals who are sitting in county jails on any given day, understates the impact of local jail detention because it's approximately 11 million individuals who are admitted, who churn through local jails in every given year. So the impact of local detention is in fact much larger than this number represents. The second reason local detention is troubling is because, as this graph says, about 75% of the people who are being detained at the local level have yet to be convicted of a crime. And so there's been some recent interest in, well, what are the impacts of pretrial jail detention? We do have a handful of rigorous studies indicating that pretrial detention, similarly to post-disposition incarceration, that pretrial detention increases post-disposition rearrest, creates worse labor market outcomes. But this evidence is only available for a very small number of large cities. And so what about the rest of the country, where it's the case that pretrial detention has been increasing most rapidly, namely in rural areas? Well, we don't have inmate level jail data. It just doesn't exist on a large scale. We might have it for one or two facilities, but not on anything approaching a national or large scale. So we just can't ask and answer these kinds of questions about the impact of pretrial detention. So the Jail Data Initiative was an effort to try to collect individual level jail data in a sample of a little bit over 1,000 counties that post their daily jail rosters online. just to show you a little bit about this, our jail data initiative. So this is a map of where we're able to collect or scrape daily jail rosters. So the map is on our website. This is just an image of it, but if you go to the website, you can hover over individual counties, and the counties in green are the counties where we're able to actively scrape. And so you can see which counties are being included and which counties aren't. We're in about a third of counties, but because we have some of the larger detention facilities, we think we're getting about half of the daily jail population nationally. So just to give you a little bit of the nitty-gritty about how this works, the image up here, where I'm circling with my cursor kind of in the top left of the screen, is an image from the Alachua County, Florida website, which is Gainesville, Florida. And this is an example of an HTML click-through jail roster where I've blocked out, with this yellow rectangle, I blocked out the names of the individual defendants. And just to say briefly a word about this, and maybe we can come back to this in the Q&A, all the data that we're collecting, all the inmate level jail data that we're collecting are in the public record. But once we collect these data, we treat them as restricted because we're concerned about the privacy of these defendants, many of whom have not yet been convicted of an offense. And so one of the things we're trying to work through is to have some kind of procedure for being able to responsibly share this information with the research and the policy and in the advocacy communities without compromising defendant privacy. And so so we're working that out. Just as a side note, I went to my IRB, the IRB at NYU, and I said, you know, I want to develop a protocol for this, and I'd like you to review it. And they just laughed at me. They said, you know, you're misunderstanding the federal common rule. All of this information is in the public record. You know, it doesn't fall under the capture of private information that's covered by IRB procedures. So we're working it out on our own as we go. So we get this click-through list, and if you click through, we get a bunch of information about each individual inmate, including charges, whether they're pretrial or post-trial, bond, level of charges. For over 1,000 counties, we get websites that look like this, and then what we're trying to do is to create structured data. And here's an example of 3 different ways that we're pulling data from these rosters. The first is at the defendant level, the second is at the charge level, and the third is at the bond level, where we have common fields that we're trying to use across these different jail facilities. And just a shout out here to our friends at the Bail Project, who've been enormously helpful in helping us when we get data from a particular county, understanding like what field does this fit into. Sometimes we're not exactly sure what it is we're capturing, so they've been helpful. So this process here, you know, we're doing the best we can to create a structure that's common across the data fields that we're capturing in every given county. It's not perfect. We still end up with a lot of fields that are unique to specific counties, and so one of the jobs on our summer to-do list is to really try to reconcile all of these fields to get everything into a single unified relational database. Right now, we're not currently in that world, but that's our goal, to get into that world. This is just what our daily workflow looks like. I won't spend too much time on this, just to say that we run 2 scrapes every day. The first runs at 6 a.m., so 5:45, we rev up the engines on AWS, and we run the scrapes at 6. It's like 1,000 of them. Then we have a little bit of time in between when the first scrapes have run and the second scheduled scrapes at 5 p.m. We have a little bit of time to try to debug any scrapes that didn't run, that failed for whatever reason. So we try to debug those, fix those, test those, get them up and ready to be rerun in the afternoon scrapes. Everything ends up over here in the right-hand orange column, just right now in a file structure in an S3 bucket on AWS, but the goal is, as I said, to put everything into a single unified relational database. And just to give you an example of you know, why we were doing this and what we hope to achieve prior to the virus outbreak, here's just an example of one of the research projects that we had started, and it's about the financial constraints faced by local county jails and the extent to which those financial constraints are actually shaping law enforcement practices in counties. As many of you may know, many jails actually charge inmates for the time that they spend in jail, and/or they're charging agencies, other agencies, federal, state, or other county law enforcement agencies to hold inmates in their jail. And you know, if there are any fixed costs to running a jail, whether it's utility bills or your personnel, your salary budget, you might have incentives to be running your jail at or close to capacity without going so far over capacity that now you need to start sending detainees to some other county, which you have to pay to detain them. So one of the things we started looking for was, you know, on a daily level, as a facility starts to hit its capacity, do we see changes in the probability of new bookings arriving and or new releases? We are seeing that pattern, which makes us think that, in fact, financial constraints are shaping local law enforcement practices. And the next step, which we haven't gotten to yet, and if anybody's interested in this, you know, reach out to me, would love to help. The next step is to try to use those kind of daily shocks to the probability that a person is arrested or the probability that they're released from jail to then estimate the impacts of detention on outcomes. That's just an example of what we were trying to do. Then, you know, this virus hits us. And immediately there is significant concern about the health of both inmates in jails and prisons, and also the health of the correctional staff who are working in those facilities. And many policy and advocacy organizations began to call for reductions in jail populations and the introduction of public health focused measures in those facilities. But, you know, we didn't have daily real-time data on either jail or prison populations. Jail populations is more where you need the daily data because they vary a lot. And so we started getting calls from policy and advocacy organizations who knew we were doing this to see if there was a way we could share our data. So one thing we started to do was we started to release, we created a public access GitHub site where we're now publishing everyday updated daily population totals for the facilities that we're tracking so that you can see how populations are changing over time. And we're also producing graphs like this on our website that we're updating daily, which show you for a set of facilities for which we have continuous daily data over some time period. So this particular graph is from January 1 to yesterday. So we don't have any breaks in the data. What do the jail populations look like? And so you can see, you know, they're trucking along here from January 1st. This peak here where I'm hovering my mouse cursor is March 16th. That's the day on which the White House finally issued its advisory guidelines for social distancing in the United States. After March 16th is when we start to see very steep reductions in jail populations. For this sample, this is now approaching, it's over actually 30%. So 30% reduction from the pre-March 16 levels. And here's a graph just using a different population where we have data from March 1 to the present, again, showing a similar pattern, just on a different scale. And I should note, we're pressed for time, right? And so one of the things we're doing is just publishing these graphs just for the raw sample of facilities for which we literally have continuous daily data with no breaks. Oftentimes we're getting breaks of a day or maybe a day or two because a scrape fails, there's a server timeout error, but we pick it up the next day and the population is relatively constant. So there are many more facilities for which we have data, for which if you were willing to do some kind of interpolation or smoothing, you could get more facilities into these population graphs. And we're just doing this as quickly as we can without doing any kind of cleaning. But we're publishing these daily population totals to our GitHub site, which is linked on our website. So if you wanted to do any of that cleaning or smoothing, you certainly could. Another thing we did was we went into our inmate level data and we pulled out any of the information that we had on date of birth or age to try to help the Prison Policy Initiative get a sense of the proportions of inmates that are being held in different age categories. They supplied the data for state and federal prisons, but we helped them with the local jail estimates. And so, you know, there's a fair number of people who are being held who are 65 years or older, and so that seemed like a priority for release. One other thing we did was we looked at the rates of decrease in jail populations by race. So this purple bar over here on the right, that's the average for this time period. And this time period looks like March, move my window here, March 16th through April 12th, there's about a 24% reduction in this sample of 341 facilities overall on average. But if you break that out by race, you can see the green bar here, the largest reduction was in the white jail population. a smaller reduction in the orange here, Hispanic jail population, and then the smallest reduction in the Black jail population. And so because of those racially differential rates of reduction, one thing that has happened is that here's the pie chart for the demographic composition of this sample of jails on March 16th. And then it's a little bit hard to see because I'm flipping from slide to slide, but this population of jails has gotten wider over this time period. And so these, that's one thing that we're concerned about in looking at these population reductions. So these are just things that we have been doing on the fly in the moment to try to help out policy and advocacy organizations, but we're also very interested in this question of, is there anything that we can learn more broadly from this episode beyond these kind of more immediate policy responses? So one question that people are really interested in, and maybe this is the main question that people are really interested in right now that I see, is what are the impacts of jail and prisons policy choices on the spread of the virus, the coronavirus in their facilities. And just a shout out here to our friends at COVID Prison Data who've done a really great job in collecting daily, or as near as daily as you can get, COVID data on tests and cases and fatalities in the state prison systems that are making this data available. So you can go to this website and find that data. So this is a question we'd all like to know the answer to, right? What are the impacts? So if a jail or a prison, started earlier to reduce its population and it reduced it more, does that mean they had less disease spread in their facility? We'd really like to know the answer to that question. It's a really hard question to assess. I think we're all becoming experts in a way. We're all becoming social media experts, put it that way, on COVID data. You see these numbers of infections or fatalities, and if you don't know how many people were tested, or even if you know how many people were tested, if you don't know the sampling frame of how people were selected for testing, it's really hard to interpret these differential rates of infection. We know that the tests vary in their accuracy and their rates of false positive, false negatives, and we now think we know that COVID-related fatalities are being underreported. So it's, one of the more careful exercises that I've seen, not in the context of jail and prisons, just in the context of trying to model the spread of the virus, one of the more careful exercises that I've seen to bound those estimates essentially came up with the conclusion that the bounds are so wide such that the point estimates are largely uninformative. So it's hard to do. One thing that we're doing is we're working with the Prison Policy Initiative to get inmate level data on all-cause mortality in the state prison systems where we can get it, which we think might be a somewhat more comparable benchmark across facilities. So we're working on getting it and seeing what we can get. But there's an even bigger hurdle here in trying to estimate the impact of these alternative choices about jail and prison policies on outcomes, which is that they're choices, right? So states and counties are making different choices about how to respond to the virus in their jail and prison facilities. And those choices are probably correlated with other things about those states or those counties that may also impact the spread of the virus, right? So these, our nerdy social science language is that these treatments aren't randomly assigned across jurisdiction, right? So to try to leverage that variation, which is the variation in the different policy choices that state and prison facilities are making, is a really heavy lift. It's arguably, you want to, and this is going to be something I'm going to throw out there and see if you all have thoughts about this, but arguably you might want to purge that variation from your data. And in the language I'm using here, that's kind of the dirty variation. You might want to look for clean variation that isn't contaminated by those confounders that are correlated with state and local jurisdictions. So one thing that I'm suggesting here as a possible alternative strategy is that researchers focus on the common temporal shock to jail populations. And throw all that state and local variation into the error term. So in other words, try to estimate the probability of an inmate being released or estimate the duration of a detention spell as a function of some critical date after which we think the benchmark for release changed, right? And so, I'm just going to use as an example the critical date of March 16th, the president's announcement, and just show you, like, for example, here on this picture, if you use a narrow temporal window around March 16th, and you're thinking about inmates who are being released here in the red circle period of time, so pre-date, and inmates who are being released here in this black circle, it looks like, right, off the cuff, it looks like that there are different probabilities of release. Although I should say, put in a plug here, this is one more reason why we need inmate level jail data, because what we're seeing in this graph is just that population's reduced. It could be that, that these reductions were achieved through just reducing new bookings. So we have to get into the inmate level data and tease out what proportion of these reductions are being achieved through increases in release, and then use those inmates pre and post to try to get some estimate. Because then what I think you could do is then you could estimate the change in the probability of rearrest for these inmates as a function of proximity to that critical date. Are they released before this policy change or after? Importantly, close in a narrow temporal window around that critical date, these inmates who are being released ought to face approximately similar post-release conditions. So yes, the world has changed. Offending has changed, crime has changed, everything about the world has changed, but within that very narrow temporal window, it's possible that these inmates who are released pre and post that date are facing largely similar conditions. And then you get to, and this will be my last slide before I wind it up here and let you guys talk. Then here's something that you might be able to learn from this exercise, which is that if what local jails, if what county jails are doing is already optimally serving public safety, then if we lower the bar for release and we, release a bunch of inmates who would not have been released had it not been for COVID, then we ought to see that these released inmates have higher probabilities of being rearrested, right? So the jails were doing a good job ex ante in distinguishing who should be released and who should be kept in jail. That's one possibility. The other possibility, of course, is that our jails were not optimally serving public safety, so that if we lower the bar for release, we might find that there aren't, in fact, any changes in the probability of rearrest, which could suggest, right, that we could, reduce our jail populations by 30% and not see any increase in reoffending. It might even be the case that we would see decreases in reoffending because we're shortening pretrial detention duration for these inmates who are being released, post critical date. We know from other research that shortening pretrial detention actually reduces rearrest. So, I think that would be a really important thing for us to be able to learn, particularly given the scale of the reduction in jail populations. We're getting an opportunity to explore these effects with a segment of the typical inmate population that we wouldn't typically see released this early. All right, I think that's all I have to say. So I guess now we will take questions.
Yeah, thank you, Professor Harvey, for your talk. And thank you to everyone who submitted questions. As a reminder, you can submit using the Q&A button at the bottom of your screen. So let's start with the question we received. Did you find that the COVID-19 related reductions affected jail populations differently along racial or gender lines?
Well, yeah. And so let's see if I can just flip back up here. So that's what we're seeing here, is that we're looking at, we are getting away from the population totals, and we are breaking the jail population as of March 16th into different racial groups. And then we're saying, okay, for these populations as of March 16th, what fraction of these populations, what's been the net change, including both disproportionate reduces in new bookings and disproportionate increases in releases. What's the net change in these populations? And we are seeing that, at least for this sample of counties, white inmates the white population decreases more steeply than either the Hispanic population or the Black population. And so actually one thing that I can say about the strategy I'm proposing about kind of, using these pre-post, the narrow temporal windows, that we can also see whether those changes differ. Hello, puppy. Whether those changes differ by race, and do that at the individual level too. And that's certainly, I think this graph is suggestive that that's certainly something we should look at.
Thank you. We have a question from Michelle here. She asks, when the formerly incarcerated are released, who is it that's monitoring their health and the health of their families?
Well, that's a good question. And that's going to vary by locality. Probably probably the most honest answer is nobody, right? And it varies. So one of the things we don't really know yet, because we haven't been able yet to track these individuals over time, is for the set of individuals who are being released, what proportion of them are being released outright, what proportion are being released with probation conditions. It may very well be the case that some facilities are releasing individuals under the condition of health monitoring, but we certainly don't know. Again, it's one of these things that we just don't know. We'd certainly like to see the health of this population monitored and tracked, but my guess is, and any of the professionals out there in the world listening to this who have some actual inside information on this, please chime in the chat. But so my guess is there's very little monitoring, but the real answer is that I think we don't know.
Thank you. So another question we have refers to your last slide about whether about public safety and rearrest. So the attendee asked, a big concern that people talk about is public safety as people are being released. Have you found a way to assess public safety in real time?
Yeah, so that's exactly what we want to try to do. And I think it's important. I think it's, this is one of these features of the policy conversation about incarceration in the United States, is that we get kind of rhetoric on both sides, right? So there's one kind of rhetoric is that we incarcerate individuals who would otherwise be a danger to their communities. And on the other side, there's a claim that that these individuals sitting in jails and prisons are not, in fact, or many of them are not, in fact, pose real danger to their communities. What the real answer is of course, an empirical question. One of the things that makes that empirical question difficult to answer is that we don't often get kind of, we're not running experiments, right, on putting individuals into jail or not into jail, or into prison or not into prison, and then watching what happens, right? So, and the characteristics of defendants who are given incarceration sentences, or who are assigned high bail or no bail, and who are sitting in jail for pretrial detention, they likely differ from the characteristics of defendants who are not given incarceration sentences, or not assigned high bail or no bail, and therefore sitting in pretrial detention. So the job for us is to try to tease apart what are the effects of both detention and release from detention on outcomes without kind of getting all of this confounding happening. But that's precisely one of the reasons why I think that this episode, right, where it looks like we're seeing, and this is what we want to get into and explore at the individual level, it looks like we're seeing this dramatic change in the threshold for release, that we can then, because we're following these jail rosters every day, we can see when somebody comes back, right? So we can see when somebody's rearrested and rebooked, and so we can get, whether they're rearrested, the time until rearrest, conditional on being arrested, charges of rearrest. So we can get these measures that are relevant to the public safety question about do these individuals pose a danger to their community? So that's the kind of thing that we think we should be doing, and that's the kind of thing that we'd like to be able to do with these data.
Thank you. So our next question is from Caitlin at NYU's Prison Ed program. She was wondering if you've seen or you're tracking state-by-state policies or emergency plans related to some of these population reductions.
Yeah, that's a great question, and we're not, but there are people who are. And I want to point you to well, there's a couple. Prison Policy Initiative has a website where they're keeping track of these policies, but then also there's an organization at the UCLA Law School, which I don't have up on my screen right now, but if you just Google them, or I'll tweet their identity later after I get off of this, but they are maintaining a really nice spreadsheet of state and local jail, state prison and jail and state prison and local jail policy responses to the outbreak, where they're collating all of the different responses by different state and local jurisdictions. So there are people who are doing that, thank goodness. And so that information is out there if anybody wants to try to use it to do some empirical work.
Thank you. So we have another question from Jennifer, who asks, for those of us who have access to inmate level data, but only across a small number of facilities, how do you suggest examining releases around the critical date?
Well, you know, so this is one of the things about doing empirical work, right? Is that if your effect size is large enough, right, you can get away with a smaller sample size. And I think right now we don't know what the effect size is. So it's the kind of thing I would go ahead and try, right? Why not try it? So as long as you've got daily data. And another thing I should say is that, you know, I'm just using as an example this critical date of like March 16th, the president's announcement of policy guidelines, because it kind of jumps out in the data. But it may very well be the case that, you know, this is an empirical question. What's the best predictor of a change in release probability at the inmate level that is not conditional on an inmate's own, you know, features or a jurisdiction's choices? So you want to find something out there in the world that shifted policy without it necessarily being, right, the product of an idiosyncratic jurisdiction's choice. So maybe that's the presidential announcement. Maybe it's the date of the first fatality in a county, right? So days since first fatality. So there's different ways to think about what kind of relatively exogenous thing could have shifted release probabilities. And I would go ahead and start, you know, what the heck, start experimenting with that and then modeling it and seeing what you can find, seeing if you can get some kind of a, you know, if you can find in the data an estimate of a sharp change in the probability that an inmate's released as a function of some, you know, some plausibly exogenous critical date. And see if it works in your data.
Thank you. We have another question here on whether or not you're aware of any historical data on the effects of other dramatic social crises on arrests, incarcerations, and releases, and whether you think in the future this type of data is worth collecting in future national crises.
So it's such an interesting question. And I have a feeling there may be other experts here in the seminar. And so I hope they jump in because the answer to the first question is I have not seen anything on that, but man, that's a fascinating question, right? So I know there are papers on the 1918 flu pandemic that estimate the kind of impacts of that pandemic on a bunch of outcomes, but I haven't seen jail or incarceration data used in any of those papers. So, you know, and I have no idea. It's interesting. You know, I've done some historical work in my time, but not on this question and not using historical jail and prison data. And so I don't really know, to be honest. I don't know what's available and how good it is. I think that's fascinating, right? That we could potentially learn something from that earlier pandemic that might be useful now. And so I certainly, whoever asked that question, I certainly encourage you to go and see what you can find. And you could use, there are a number of econ papers that are looking at the 1918 flu pandemic that you could use as like an empirical model as long as you had the prison data. To answer the second question, I think the second question was about should this inmate level jail data be available, you know, in case we have another pandemic. I mean, you know, jails, we're taking people into custody, right? We're taking their civil liberties away. It's just about the most heavy-handed thing that a government can do to you. And the fact that we don't maintain records that are available and accessible to researchers that would allow us to estimate the impacts of this kind of an intervention in a person's life. I mean, I could go on about it, right? It's even setting aside the question of like the next pandemic. This is data that should be reported up to states in the first instance, and then it should be reported from the states to, Bureau of Justice Statistics or some federal statistical repository. And even if it's restricted, right? So we're accessing it through one of the restricted data centers. It should be available to researchers, and the fact that it's not, I think, is awful.
Thank you. So our next question is from Rebecca, and she asks, are there general characteristics for the counties whose data is available for scraping? Do they tend to be larger counties or larger jails, or certain geographies or demographics?
Yeah, thanks. That's a great question. Actually, well, you should contact me after the webinar, and I'll send you some of the, when we were first thinking about this project, one of the things we did was we identified the counties where we thought we could scrape, and then we pulled the census data on the most recent census data on those counties to try to get a sense of how representative these counties were. And initially, the pitch that we were making for the project was, and it wasn't really a hard pitch to make, was simply that these data would be more representative than the jail data in the 4 or 5 studies, using these large cities, Miami, Philadelphia, New York, Pittsburgh, Houston, that we'd seen. And so, and when we pulled the data and we looked at these counties, they're certainly, they're less affluent. This is relative to those cities. They're less affluent, they're whiter, they're more rural. So we felt like we were definitely getting a broader swath of the population. What we didn't do, what I think is interesting, and I'm happy to share these with you, and I think that's kind of an interesting question, the selection into why some counties publish these jail rosters and some don't. You could look at you could model that, right? So the features of counties relative to all 3,007 counties, if I'm getting that right, to see if there are identifying features that distinguish the 1,000 or so counties that have the online jail rosters relative to the full set of counties. That's something we haven't done, but I think that's an interesting empirical question and worth writing a paper about, the selection into the sample.
Thank you. So we received a couple questions about healthcare. Are you aware if the government is doing anything to provide health coverage to recently released inmates?
Yeah, so that's something that I would go to. I think Prison Policy Initiative is tracking this, as well as the UCLA Incarceration Project. Marshall Project might have some information about this on their website. And again, there's so much local variation across this. These are tough times, right? And state and local budgets are all of a sudden squeezed in ways that we couldn't imagine, 2 months ago, we couldn't imagine even a month ago. And so my own prior is that I'd be skeptical that any efforts are really being made to provide services to these recently released inmates. But it's the kind of thing that, again, it's kind of like, because we don't really have data on even if we, like, say we go into our inmate level data, we can identify who's being released, but then, to be able to track their health status or their employment status, the one thing we can reliably track is simply whether they're rearrested, because we'll be able to see that. But again, this goes back to this other question about the availability of data, and this is something that researchers like me tend to harp on, which is that we spend so much money on these practices, and these practices, they impose not just financial costs, but also costs on these individuals, and yet we know so little about their impacts, and we seem to be okay with that. Whereas in in some other countries, there's a real effort made to collect detailed administrative data and to link those data across, earnings and health and education and criminal justice, so that we can start to have a sense of what our policies are doing to people in terms of their outcomes. And so we simply lack that information. And I don't know whether the pandemic is going to be kind of a watershed moment where people realize they really would like to be able to know what impact this is all having on people. My guess is not, but certainly we're not in a world right now where we can reliably track that.
Thank you. Yeah, thank you, Professor Harvey, for taking time out of your afternoon to speak with us today. I think we have time for one last question that we've been asking all of our WAG Talk speakers. And, this is a really difficult time for everyone, a time of transition. What gives you optimism in relation to this subject going forward? Are there any takeaways or policy improvements that can be made as a result of the data or changes in incarceration that you're seeing?
Well, so, glass half full, glass half empty. We did see relatively large reductions in jail populations, right? Whether out of concern for inmate populations or correctional staff or both, and those populations are continuing to come down, not at the same very steep rate that we saw in mid-March, but we're continuing to see some reductions. And so maybe it's heartening to think that there was in fact a policy response, and that, you look at the steepness of those drops, some of that response happened very quickly, within only a week or 2 weeks. Now, arguably, maybe the drops should have been steeper, maybe they should have been less steep. That's the kind of thing we're going to want to try to figure out using the data, try to estimate what the impacts of those drops were. The other thing I would say that's heartening is just that the policy and the advocacy communities have really stepped up. And we've gotten to know some of the people in those communities and have so much respect for the level of effort and passion that they put into this work. And people out there who are just working tirelessly on their own dime to create websites and produce data and share data willingly with everybody. That nobody's got their elbows out. I mean, everybody's sharing data and working together on behalf of this population. And so it's not all bad news.
Well, thank you, Professor Harvey, for joining us today. We really thank you for your thoughtful remarks. And thank you all for joining this talk. We hope all of you will join us for tomorrow's talk with Professor Gernot Wagner, who's going to be discussing climate change and the coronavirus. Also, you can be sure to visit our YouTube page at youtube.com/NYUWagner, where we're going to upload this video of this WAG Talk and all the other installments in the WAG Talks COVID-19 series. Finally, you can check out our full slate of NYU Wagner's virtual events at wagner.nyu.edu/events. And we thank you all for joining us and hope to see you tomorrow. Thank you.
Thanks.